At OnlineMedEd, we walk you through every topic in detail, so you're ready for the boards and the wards. Gender dysphoria is a pretty low-yield topic for your tests. But if you're going to be in an urban environment where the LGBT community is quite prevalent, knowing the terminology and how to speak to somebody is really helpful in actually helping these patients. If you walk in and are confused by how they feel and what they look like, they're going to recognize it right away, and you're not going to be able to take care of that person. So in this lesson, what I want to do is come up with some vocabulary you should have so that you can communicate in that world, and then spend a little bit of time on gender dysphoria disorder. Included in your notes are going to be some of the paraphilias that just aren't high yield enough to make it into the lesson, and they're generally pretty well distributed across the country or in the world, so people know what they are. And generally, those only respond to incarceration if you violate someone else's private space, rights, whatever. So what I want to do is start off with gender terms and finish off with gender dysphoria. The first thing you need to know about is the assignment. And the assignment is given to you by an adult when you are born. That is typically male or female based on an unambiguous external genitalia. You either have a penis and are male or a vagina and are female. This is going to be the body. It's what you look like. And it is a phenotypic expression. Classic example of this is going to be Mullerian agenesis or testicular feminization. Chromosome-wise, XY. But since there's androgen insensitivity, the patient develops phenotypically as female. The assignment is therefore female. It is phenotype, it is what you look like, it is what you have on the outside that determines your assignment. Compare that to the identity. This is what the patient thinks they are. This is the internal belief. See this as the mind. Most of the time, the assignment is congruent with identity. When it's not, the patient is considered to be transgender. That is, the identity is incongruent with the assignment. There's a problem that the mind isn't working out with what the body is showing. Up until recently, in the past few decades, homosexuality was considered a disease. No longer. It's normal. Homophobia is a disease, whether it's learned or ingrained, regardless. So I want you to begin to realize that people have a spectrum of assignment and identity. Some are men with the identity of men who want to have sex with men. Homosexual, gay. Some people are women with external female parts, but are men inside. That's transgendered. For those people not used to hearing these terminology, it may be a little confusing. I'm trying to keep it simple. Transgendered is when there's an incongruent identity and assignment. Someone who is transsexual is someone who has made the switch. It's easy to comprehend the change in the body. A phenotype male person has breast implants, removes the penis. That's someone who is transsexual, made the switch. But also, it can be simply a change in the social adherence, the way people treat them. If a woman dresses like a man and the rest of the society treats her as a man and thinks she's a man, then that's technically transsexual. It's easy to understand the change in the body because it's physical, it's visual, and that's the one I think you should latch on to, but also it's considered transsexual if they've made the switch without changing their body, but changing their social status. Unrelated, but often tested against one another, is transvestism. A transvestite is someone who cross-dresses, wears the clothes typically associated with the opposite sex, but they are not transgendered. A man has a penis and believes he's a man, he just likes wearing a dress. A woman has a vagina, she just happens to like wearing a tuxedo with a top hat. But transvestitism is generally considered that when there is sexual arousal. Just getting dressed up because you can or because it's different isn't really transvestism. It is borderline paraphilia. We've now considered this on the normal spectrum of sexual arousal, but it still has a name because it's close to paraphilia. Those people who are progressive in the LGBT community or equal rights for men and women might find that annoying. Dressing up in a dress is considered almost a disease for a man, but that is still the case in the DSM-5. Gender terms, major focus. Gender dysphoric disorder is where we're going. And you might guess it, gender dysphoria occurs when the identity is incongruent with the assignment. But it's more than just that, it has to also cause distress. Impaired emotionally, professionally, financially, whatever, causes distress in the patient's life because they think they are the wrong thing. This must last for more than 6 months. And of course, there's an identity that's incongruent with an assignment. There's some other criteria here which also count. There may just be the desire to be or be treated like the opposite sex. Or it may simply be to rid themselves of secondary sex characteristics, to become asexual. And this last one is the hardest to grasp, which is the patient simply believes they are. This last one sounds like a delusion. In the psychotic disorders, we talked about delusions as fixed false beliefs that could be true. Simply believing that you are already the other gender is enough to be considered gender dysphoria disorder. It's not a delusion. But it's weird because they may not want the treatment, the therapy, which is psychotherapy and gender reassignment. They may have already made the switch on their own. That's gender dysphoria. The diagnosis is, of course, clinical, and the treatment is going to be primarily with psychotherapy. You need to make sure that indeed they have gender dysphoria and aren't simply experimenting. Because ultimately, if what they want is gender reassignment surgery, once you go under the knife, you can't go back. Gender reassignment is mutilation if after the surgery they realize, oops, I don't have the disease. So intense psychotherapy needs to be performed in order to ensure the person truly does have gender dysphoria. In kids, this might be manifested simply as the rejection of same roles, or acceptance of opposite roles. A boy dresses up in a dress and plays tea. A girl dresses in fatigues and plays army. Again, those of you more progressive might be asking, why is that abnormal? Well, because we've defined it as gender dysphoria if it lasts for more than 6 months, and it's not just kids playing around. It's not kids experimenting. It has to last for 6 months and cause distress. Just dressing up isn't enough to do it. So it becomes disorder when there's distress. Doing these things just for fun is okay. It's a disorder when that incongruent identity and assignment relationship causes distress. If it causes distress in an adult or in a kid, you need to work it through, make sure it really is a disorder, not them experimenting, and ultimately, gender reassignment surgery. So this lesson was identify some vocabulary and learn about gender dysphoria. And don't forget to check out the notes for some of the even lower yield diseases which we've written down but aren't going to put on the video. That is gender dysphoria.